Okay, so it's short.
Okay, sounds good.
All right. Hey, I'm with Dr. Scott Manchester, who's in Jackson, Mississippi, or I'm sorry, Jackson, Michigan. And you've been a chiro 23 years, correct?
That's correct.
And we were connected through Dr. Kirby Peralt, who's just one of our early pioneers in this field. He's in Okemos, Michigan. Is
Okemos.
that correct? Yeah,
Okemos,
something
yeah.
like that. You can tell I'm dyslexic. But I remember our first call. You were pretty excited about this, and I think you said something like, "If this really lives up to what you say it is, we're gonna love it," you know. And you've had the device 2.5 months. Kind of tell me where we're at. What are you noticing?
Yeah, I tell you, literally been like a game changer for our office. It's given us the ability to treat things in our clinic that we had zero answer for in the past, and not only just treat them, but treat them efficiently, treat them fast, and get them the results that they wanted. And in the beginning, I was a skeptic. I was a skeptic myself. I went to Kirby's office, experienced it, and my mind was blown. And that's what pushed me over the edge. And now we're doing that to patients, and it shows. Like we have a waiting list for it right now.
You are a waiting list practice. That's what we all dream of. You know, I had someone say to me the other day, to Duro, I see all these docs, they're copycatting the way what you do and how you do the thing with the soft wave. I'm like, you don't think that was kind of premeditated? The way we reverse engineered this. I mean, like, listen, 6 years ago, I kind of experienced it the same way. I was out of work for 3 years after a wrist surgery on my right hand, and I couldn't adjust. I couldn't swing a golf club. I couldn't ride a bike. Any type of extension caused so much pain for me. But it was literally 3 treatments over 10 days. I was 90% better. I bought a device and I didn't have to treat my wrist for 14 more months. And I could have done
Right.
it every week. So I'm excited. I was skeptical as well. Like supersonic sound waves that travel
Right.
3,000, yeah, whatever. But it's like the proof is in the pudding. You
Absolutely.
have to feel it to heal it. And um, kudos to you for going through with it. Sometimes it sounds too good to be true,
Yep.
but our red flags pop up. So, kind of walk through, like when you say the conditions that normally you couldn't help. What are some of those? What do you see in the best results with?
It's kind of a wide range of things. I mean, we're pretty much treating almost everything with it, but like, sustained plantar fasciitis, that's been a big one, for people that, like besides fitting them for some orthotics in the past, we didn't have a whole lot of answers.
Hmm.
Knee pain's been another big one.
Knee
with
pain, knee pain, knee pain. I mean, we become a niche knee clinic. And I always
yeah,
say there's riches in niches, bitches.
yes,
And that's kind
yeah,
of how that's our tagline. Um,
yeah,
so knees are great. Any type of itis, any type of inflammation,
yep,
anybody that's hit a wall, that even before I send them to acupuncture, I'm using this technology. Like in the algorithm of healthcare, you exhaust every conservative effort first that's non-invasive. You don't jump to the most expensive, most invasive thing, right? So
right.
that's what you're experiencing. And tell me some, like, what are your patients thinking? How are they feeling about it?
Well, I mean, after that first treatment, I always, so kind of our routine in the office is I see a brand new patient before they go in. We
Hmm.
do the treatment and then I see them again right after and we talk about it. And, majority of them, their mind is just blown. They haven't felt this good, in a long time. And we've only done one treatment. So it's a no brainer. They want more of it. And, I think
Yeah.
that we're excited about it. They're excited about it. And they can't believe it, but they want more. That's what we see.
Yeah, exactly. And to be honest, in 30 years of being in healthcare, this has the highest patient case acceptance that I've ever seen
Yeah.
because of the way we do that discovery day. Before we know within 3 or 4 minutes if they're candidates for this
Yeah.
futuristic
Absolutely.
technology. So I mean, and how is it user friendly? Is it difficult? How, on a scale of one being no problem, 10 being difficult, what would you say? What are the
Yeah. I mean, as far as being user friendly, it probably couldn't be more user friendly. You know, it's, I mean, if one is the best, I mean, it is right there at one. And you know, the other great thing that we found is, you know, with the academy, the SBA Academy, you know, I got linked up with Dr. Rob Mayer, and he's been great. So any little questions, you know, I've just been able to shoot him a text, and he responds right back. And it's been a fantastic experience across the board. Like I said, it just blows my mind, to be honest.
Yeah, I mean, you're a chiropractor as well, 23 years.
Yep.
You know, let's face it, chiropractors are somewhat of the redheaded stepchildren of healthcare. You know, only 11% of the population will even consider going to see a chiropractor, right? I
Yeah.
think there's a lot of misconceptions. They don't understand what we do. But this device is the great equalizer. It's like patients don't care what are the last two letters after my last name, what type of doctor I am. They just want the results that they're seeing on digital media and social media. And it's like that's what drives them in. And again, we know within minutes, right? That the diagnostic component of this is what it just blows me away. Like you can scan a chief complaint and map out that area within 3 or 4 minutes. And if we can't find any tender spots or hot spots, they're not candidates, you know?
Right.
So, but on the inverse side of that, the more pain and discomfort they have while we're mapping out that area, the better clinical outcomes. Have you noticed that as well?
Absolutely. Absolutely. Yeah, we go through that entire process, you know, in the beginning of mapping it out and figuring out where all the areas are. And you're right, you know, if we can't find the areas, we, you know, we're upfront with them. We tell them like, listen, you're not a good candidate. And, you know, we refer them back to, you know, wherever they came from. But yeah, as far as the outcomes though, absolutely.
And by the way, I don't kick them out of the office. I just don't offer them a package deal. I'm
Right.
like, you know what? Sometimes people need a second or third visit, you know, but at this time, you know, I like to see people get results. Like it's near immediate relief, and that's the most beautiful thing. Well, I'm so excited. What would you tell that doctor? Because I've spoke to 3,300 doctors, only 550 of them have purchased. What would you say to those other 2,500 docs that are sitting there? They're on the sidelines, still watching. What would you say to them?
Well, I would say, you know, you know, you're probably skeptical like I was to start, and that's part of the reason why it took me so long to make the decision. But I would say don't be skeptical. You know, what you guys have told me is exactly what has happened. Jump in, but also listen to what you guys have to say, because you guys have it figured out. You know, so if you do come on, don't be a lone ranger and try to do it yourself. We did everything by the book, and it's like I said, it's only been a little bit over 2 months, and we've collected enough already to pay the machine off. So
you completed the 90-day challenge.
I didn't know I was doing it, but
yeah, you are.
As of yesterday, I mean, I don't know if I can say collections or not, but
sure, go ahead, please.
Okay, so as of yesterday, we have treated about 125 different people starting on December 13th. And keep in mind, you have the holidays in there. We've also had to close on 3 or 4 different days because of weather where we're located. We've had 75 people buy packages, and we have collected just a little bit more than 90,000.
Absolute. That's just
game
awesome.
changer.
And yeah, really, game changer it is. And that's why, like, people, they get fixated on the price, right? And I'm like,
I was that guy.
Yeah, and I kind of yell at them. I'm like, listen, if that's all you're considering with price, then maybe this isn't for you. Like, this is the Rolex of, you know, medical devices, especially in the you know, shockwave industry. So, but I, you know, over 55% of my doctors are successful with that 90-day challenge, and they get $1,000 towards in Softwave bucks to buy swag or towards their next refurbishment or whatever they need. So congratulations on completing it. And, you know, it's I talk about the ROII, right? It's not, it's the return on impact in your community. Like you're
Right.
bringing a world-class technology to your little community in Jackson, Michigan. And
Yeah.
that's the thing. Like the ROI, the return on investment is second. And some people get those two things mixed up.
Right.
But you are investing in the future health of your community. There'll be less people taking medications, less people overdosing on prescription drugs, less people getting cortisone injections, less people needing joint replacements. Those are the things. You, my friend, will have a eternal impact on your community for what you invested in.
Yes,
Okay.
absolutely.
So thanks so much. I think that completes our recording part, but I'm super excited, and you can stop recording.